India is now devastated by the second wave of COVID-19. With more than 4,000 death cases every day, insufficient hospital beds, and oxygen supply, the health sector has collapsed dramatically. This has not only affected the natives but also the neighboring countries. Countries like Nepal, Bangladesh, and Sri Lanka imported vaccines from India. After surviving the first wave of the infection, many of these countries are facing the tragic nightmare of want of vaccines. As the number of COVID cases kept on growing in India, the government put a temporary ban on exporting COVID vaccines. This greatly impacted the COVID situation in Nepal and some countries in Africa. Nepal, widely famous as the Holy Land of Himalayas, is now experiencing a rapid rise in the number of COVID cases. There are more than 20 death cases per day. Health officials in Nepal stated that at least 1 in 2 Nepalis is tested positive every day. This has alarmingly raised the positive rate to 50%. Hospitals in Kathmandu, the capital of Nepal, have declared an emergency need for medical equipment and vaccines. People are running from hospital to hospital to get a hospital bed for the infected. Till now, the country has been dealing with the COVID cases by importing liquid oxygen from India, but the catastrophic condition in India has forced the government to stop exporting liquid oxygen to Nepal. This crisis of liquid oxygen has shed out many lives. There are no rooms in intensive care units. All the ventilators are engaged, so the newly affected people are dying for want of medical facilities. Recently, the country has also faced a political crisis. The internal rebellion of the ruling party led to the dissolution of the parliament. The economy of the country started to shatter. To restore the economy, lockdowns were removed. People were rushing to the workplace, completely neglecting the fact of social distancing. This led the pandemic condition to keep on worsening. Mass people were indifferent to wearing masks and ignored the importance of sanitization. Like other countries in the world, the Nepal government smartly handled the first wave of COVID. Strict lockdown and proper sanitization improved the condition by many folds. But the condition started deteriorating when people started participating in government and non government rallies, crowded religious programs, and many wedding ceremonies. However, the negligence of the government in handling the COVID cases was visible in many sectors during the second wave. When the whole world was under lockdown, the migrants were urged to rush to their countries. They can't be blamed for that. Many of them faced a financial crisis. Nepalganj, a small city of the outskirts of Nepal, became the entrance of many migrants. The government did not quarantine them strictly, which resulted in increased number of COVID positive cases. After running out of AstraZeneca medicine, the Nepal government is looking forward to securing vaccines from China and Russia. Though about 2.1 million people have been vaccinated, only 40,000 of them were lucky enough to get both doses. Ironically, this is not even the 20% of their population. The United States nations has also urged to ensure vaccine supply to Nepal to combat the crisis. Vaccination programs in many important cities of Nepal were halted temporarily. After that, to restrict the widespread of the infection and to bring the whole condition under the control, the UN shared their thoughts to spare vaccines to the Nepalis.